Hello doctors, and welcome to today's program. Today what I want to focus on is low back injury and spinal instability. Today, low back injuries are the #1 cause of chronic pain and disability in the world today. More people suffer with low back problems than any other condition in the market today. It's the most expensive condition that there is currently in the market. It is actually more expensive than about 300 other medical conditions. And it's very significant to the people whose lives it affects. There's not a person that is not somehow influenced by somebody or around somebody who has chronic problems with their lower back. It's a very prominent condition, and it does not need to be that way today. Employers definitely need help with this condition. According to the National Safety Council, an average medically attended injury in the United States of America today, on average, costs $42,000. Those are unsustainable numbers. Those are unsustainable numbers for employers. Those are unsustainable numbers for insurers. Those are unsustainable numbers. That's way, way, way too high. It doesn't need to be. Now, the biggest problem in the market today, especially in the injury market, is understanding the underlying injuries. The most common diagnosis of a low back condition or a low back injury is called nonspecific mechanical low back pain. Nonspecific, no one needs a definition for that. Mechanical means there's a physical thing that's causing a problem, that's causing the back pain. Nonspecific mechanical low back pain. The #1 diagnosis for neck is nonspecific mechanical neck, which we'd get to in a different program. So focusing on the lower back, that is the most common diagnosis in the market today. What are the costs? The costs are astronomical. And the biggest problem with the cost, the reason why the costs are so expensive in the market today, is because we're not accurately diagnosing the actual underlying condition. That's why non-specific mechanical low back pain is the #1 diagnosis. Well, how about if we get specific with what mechanical thing is causing the problem in the first place, and then innovate our treatment in order to address that area? We could overnight knock out and significantly reduce and take this out of being the #1 physical cause of chronic pain and disability today. There's not a person in the world that can convince me as a doctor who's been licensed for over 30 years now that people want to be disabled. They want to have a chronic problem. They don't. What we need in the injury market is much better doctors. So let's understand spinal instability. Spinal instability is the #1 cause. It's the #1 mechanical cause of low back pain, chronic pain and disability. And it's the easiest thing in the world to diagnose. It's very easy to diagnose. How do you diagnose it? The patient comes in, you do muscle testing. Various muscles will test for various nerve levels. You do muscle testing. You do sensory testing. And you do pain correlations. Different areas of the spine produce different pain patterns. You do those 3 things. They lead you to a level. Now, you realize, great, I believe that I have a ligament condition here. So you do what's called stress radiology. Those are specialized x-rays where the patient is standing, they're weight bearing. They bend forward, they bend backwards. You do good stress x-rays that show intersegmental motion. You then send those x-rays out to board certified medical radiologists to have them accurately measure the intersegmental motion that's found in the patient. You then take that intersegmental motion, you correlate it to where you have the motor deficit, the pain problem, or the sensory deficit, and you have the spinal instability. You have the underlying cause. That is the cause of the problem. Spinal ligaments themselves are incredibly weak in comparison. So if I take a 10-pound weight and I put it to my chest, I've just added 100 pounds of pressure to my lower back. If I take that same 10-pound weight and I push it out 25 inches from my chest, I've added 250 pounds of pressure into my lower back. That 250 pounds of pressure is strong enough to actually completely damage every single one of the ligaments in my spine. Now think that's with 10 pounds. Think about 100 pounds. Let's say you were healthy enough that you could do 100 pounds out 25 inches from your body, right? You're a weightlifter, you're a young guy. That's 2,500 pounds of pressure into the lower back. There's not a ligament that would actually survive that. So why is the spine able to do that? Why is the human body able to do that? Well, it's able to do that through a coordination system where the pressure is felt in the ligaments. That pressure translates to an immediate message to the muscle system to provide the leverage and protection and to actually be able to accomplish the task without damaging the human body. It's very instantaneous. Now, when that system is interrupted due to ligament damage, we call it a spinal instability. And that spinal instability, again, it's a motor, sensory, and pain correlation to a very specific level, and then it's stress radiology and excessive motion testing to test if we have excessive motion at that level. If we do, we have a spinal instability. Now, we also could have a disc herniation. Remember, there's two imaging biomarkers for ligament damage. One is excessive motion. That's the most important imaging biomarker there is in the market today. It's the most underutilized. The second is disc herniation. Right? But even with a disc herniation, doctors, if your patient has a disc herniation, the first thing any patient who has a disc herniation and a doctor that's working with a patient that has a disc herniation should be asking, remember there are 10 ligaments that hold the motion unit together. Only one is a disc. The other 9 are supporting ligaments around that disc that support with the disc the whole motion unit. If they're sheared, you will pick up excessive motion. So if you have disc herniation with severe excessive motion at, below, or above the level of the disc herniation, that is a completely different patient. So patients today need doctors that really understand spinal instability evaluation quickly, cost effectively, so that the patients can get to the right treatment quickly. That's what reduces down the risk in chronic pain for low back conditions, which again is the #1 cause of chronic pain and disability in the country today. That's what we're producing with Smart Injury Doctors that are doctors for back and neck injuries. That's what we're producing today in programs that I assist with and have developed called the Smart Injury Doctors program. We're producing them because our country and everyone in the world actually needs better understanding of these conditions fast. These conditions are simple. They're not significant. They're not hard. They're not complicated. There are factors that are complicated about them, but the condition itself and diagnosing it is very simple, and it should be a standard procedure in every single low back injury in the United States today. Doctors, every time I do a program, it's just a short topic, short amount of information. You can always find more information at the Smart Injury Doctors program. You can always find more information on other podcasts, but each podcast is to give you a short understanding of a particular topic or a viewpoint of a particular topic so that you can maybe shift your viewpoint on it and become better at what you're doing and hopefully help that improve your patient results. Thank you very much for your attention today, and I look forward to you on our next program. Thank you.